Edward Jenner. He was born on 17 May 1749. He lived up to 26 January 1823. Edward Jenner was born in Berkeley, Gloucestershire. He was the eighth of the nine children born to the vicar of Berkeley, the Reverend Stephen Jenner, and his wife Sarah. He was a British physician and scientist who pioneered the concept of vaccines, including creating the smallpox vaccine, the world's first ever vaccine. Edward Jenner is well known around the world for his innovative contribution to immunization and the ultimate eradication of smallpox. Jenner's work is widely regarded as the foundation of immunology, despite the fact that he was neither the first to suggest that infection with cowpox conferred specific immunity to smallpox nor the first to attempt cowpox inoculation for this purpose. The term vaccine and vaccination are derived from variola vaccine, that is smallpox of the cow. The term devised by Jenner to denote cowpox. He used it in 1798 in the long title of his inquiry into the variola vaccine known as the cowpox, in which he described the protective effect of cowpox against smallpox. In the West, Jenner is often called the father of immunology, and his work is said to have saved more lives than the work of any other human. In Jenner's time, the smallpox killed around 10% of the population, with the number as high as 20% in towns and cities where infection spread more easily. Education and medical training. Jenner went to school in Wotton under Edgen, Cirencester, during the time he was inoculated for smallpox, which had a lifelong effect upon his general health. At the age of 14, he was apprenticed for 7 years to Mr. Daniel Ludlow, a surgeon of Chipping, Sudbury, where he gained most of the experience needed to become a surgeon himself. In 1770, he moved to St. George's Hospital in London to complete his medical training under the great surgeon and experimentalist John Hunter. Hunter quickly recognized Edward's abilities at dissection and investigation, as well as his understanding of plant and animal anatomy. The two men were to remain lifelong friends and correspondents. In 1772, at the age of 23, Edward Jenner returned to Berkeley and established himself as the local practitioner and surgeon. Although in later years he established medical practices in London and Cheltenham, Jenner remained essentially a resident of Berkeley for the rest of his life. Cowpox. Like any other doctor of the time, Edward Jenner carried out variolation to protect his patients from smallpox. However, from the early days of his career, Edward Jenner had been intrigued by country lore which said that people who caught cowpox from the cow could not catch smallpox. This and his own experience of variolation as a boy and the risks that accompanied it led him to undertake the most important research of his life. Cowpox is a mild viral infection of cows. It causes a few weeping spots or pocks on their udders, but little discomfort. Milkmaids occasionally caught cowpox from the cows. Although they felt rather off color for a few days and developed a small number of pocks, usually on the hand, the disease did not trouble them. The first vaccination. In May 1796, a dairymaid, Sarah Nelmes, consulted Jenner about a rash on her hand. He diagnosed cowpox rather than smallpox, and Sarah confirmed that one of her cows, a Gloucestershire cow called Blossom, had recently had cowpox. Edward Jenner realized that this was his opportunity to test the protective properties of cowpox by giving it to someone who had not yet suffered smallpox. He chose James Philip Phipps, the 8-year-old son of his gardener. On 14th May, he made a few scratches on one of James's arms and rubbed into them some material from one of the pox on Sarah's hand. A few days later, James became mildly ill with cowpox, but was well at again a week later. So Jenner knew that cowpox could pass from person to person as well as from cow to person. The next step was to test whether the cowpox would now protect James from smallpox. On 1st June, on 1st July, Jenner variolated the boy. As Jenner anticipated and undoubtedly to his great relief, James did not develop smallpox, either on this occasion or on the many subsequent ones when his immunity was tested again. So publication. Jenner followed up his experiment with many others. In 1798, he published all his research into smallpox in a book entitled An Inquiry into the Causes and Effects of the Variola Vaccine. a disease discovered in some of the western countries of England, particularly Gloucestershire, and known by the name of the cow's pox. In each of the next 2 years, he published the results of further experiments which confirmed his original theory that cowpox did indeed protect against smallpox. Opposition within the medical profession. Jenner's newly proven technique for protecting people from smallpox did not catch on as he anticipated. One reason was a practical one. Cowpox did not occur widely, and doctors who wanted to test the new process had to obtain cowpox matter from Edward Jenner. In an age when infection was not understood, cowpox samples often became contaminated with smallpox itself because those handling it worked in smallpox hospitals or carried out ventilation. This led to claims that cowpox was no safer than smallpox inoculation. The anti-vaccinationists. People quickly became fearful of the possible consequence of receiving material originating from cows and opposed vaccination on religious grounds, saying that they would not be treated with substances originating from God's lowlier creatures. Variolation was forbidden by Act of Parliament in 1840, and vaccination with cowpox was made compulsory in the year 1853. This in turn led to protest marches and vehement opposition from those who demanded freedom of choice. The spread of vaccination. Edward Jenner spent much of the rest of his life supplying cowpox material to others around the world and discussing related scientific matters. He was so involved in corresponding about smallpox that he called himself the vaccine clerk to the world. He quickly developed techniques for taking matter from human cowpox pox and drying it onto threads or glass so that it could be widely transported. In recognition of his work and as a recompense for the time it took him away from his general practice, the British government awarded him £10,000 in 1802 and a further £20,000 in 1807. The eradication of smallpox. In 1967, the World Health Organization launched its campaign to eradicate smallpox worldwide. They estimated at that time that there were still up to 15 million cases of smallpox each. The biggest problem areas were South America, Africa, and the Indian subcontinent. Their approach was to vaccinate every person in the areas at risk. Teams of vaccinators from all over the world journeyed to the remotest of communities. After a period of watching for new cases in 1980, the WHO formally declared smallpox is dead. The most feared disease of all time had been eradicated, fulfilling a prediction that Edward Jenner had made in 1801. It has been estimated that the task he started has led to the saving of more human lives than the work of any other person. But Jenner was found in a state of apoplexy on 21st January 1823 with his right side paralyzed. He did not recover and died the next day of an apparent stroke. His second, that is on 26th January 1823, age 73, was buried in the family vault at the Church of St. Mary, Berkeley.